What's good, DMV? Jackie Paige here hanging out with you, and I'm so excited to be doing this. Girl Talk Live is happening. You know how we get down on 93.9 WKYS, so it's about to go down right now. Outside is about to open up. We have been stuck in the house. We have been bundled up. Our faces have been thrown under a mask, and we need to figure out the things that we need to be doing to make sure that when we go outside, we can live our best life and look our best. So today, I am so excited because I have so many questions for you. I don't think you understand. I have Dr. Vikisha Fripp, board certified plastic and reconstructive surgeon with me today. She specializes in non-invasive facial rejuvenation techniques as well as surgical solutions for body contouring. Dr. Fripp, how are you doing today?
I am amazing. I made it through hump day. The weekend is around the corner. So this is like a midweek turn up for me. So thank you for having me.
Listen, I am so happy that you were taking a few seconds to talk to me in the DMV because when I say the questions are real, the questions are real. We have been, like I said, stuck inside. We just learned early this week, DC about to be wide open in a few weeks.
I know.
Like, I'm kind of sort of ready, but I'm not ready. Like there are things that are going on that we need to get answers to. So let's go ahead and just get into it and get your expertise advice so we can make sure that we're out here living our best life. So we've been inside for a very long time. We've had masks on. It's been winter time. And now it's time for us to go outside and see the sun again. What are the things that we need to do to get our skin ready for this transition?
That's such an amazing question because winter itself has the potential to dry the skin. And so we've been wearing masks, which further dry the skin. And then we have that colder climate that causes such harsh air to be against our skin. So the first we have to always do is moisturize. Now, I am a moisture, look, mist, and dewy girl. I love my skin to just shine on its own. And I do everything for that to be duplicated in my patients. So we have to put moisturizer as a part of our daily and nightly routine. So every morning we need to be applying a moisturizer with SPF. And then every night we need to be applying a moisturizer. And if you're a mature woman like myself and you've made it over 45, it's time to start adding in some retinoids as well.
So in all honesty, I hear you say moisturizer. I suffer with, I like have acne prone skin. So when I hear moisturizer, I'm like, my face is already oily. Like, I don't really know like if I should be doing this whole moisturizer thing. And then when you start talking about an SPF, for me, as a Black woman, I'm like, oh, that's more moisture. Like it's already oily. So for us Black women out here who have acne prone skin or really oily skin, what would be your advice there?
See, I have acne prone skin as well. So, but we always thought that the answer was to dry the skin. Remember, if it's wet, make it dry. If it's dry, make it wet. That's not true. The skin does need moisture though. Even if you have acne prone skin, we use the non-comedogenic moisturizer. Comedogenic meaning acne forming. So we use the moisturizer that does not cause and contribute to acne. So that's what we have to be cautious. So we can't just go into CVS or we can't go to the Lancome counter, go stand by Bobbi Brown and say, give me everything. We have to give them a little information first. And we tell them, hey, listen, I have acne prone skin. I don't need anything that's going to clog my pores. And once you say that, you should be directed to the right product. Now, I always look for something that, again, is non-comedogenic. That is non-acne forming. But your skin has to have moisture. Even though Black skin has that, we call it oily T-zone, that's not enough moisture, believe it or not. It's not. That's oil. See, oil and moisture can't be confused. The oil that we emit keeps us looking young. That's why they say we don't crack. So we don't ever want to do anything, right, that makes our skin dry because we actually need that moisture because our skin is so thick and it's so pretty and all these hues that come out are always accentuated by a little bit of oil.
So what about SPFs? That's another thing that I'm just like,
I know. And people are like, I don't want to look ashy. So that's why I don't wear sunscreen. And I get that. That's why we're going to the more hydrating sunscreens. And again, we're looking for a sunscreen that causes you to have moisture, right? So there are a slew of over-the-counter. Neutrogena makes one. Pharmacy makes one. I think the gold standard is La Mer, but of course, you know, that is a little expensive. But it depends on what you're doing, right? So if I am going to my boys' baseball game, of course, I'm just putting on my Neutrogena, right? But if I'm going to Miami with my girl or Miami with my beau, then I'm wearing my Lumiere because I want to just be fancy and I want to just show up amazing, right? So regardless, though, we need to look for an SPF product that has moisture in it. If it says hydrating, these are all the best words. If it says gel, these things make us happy, right? Because that is what we need to add moisture to the skin.
So what about, is there a particular like number in SPF? Because I know there's like SPF
all the good questions.
Because literally, this is stuff that I deal with on a day in and day out basis.
Oh
and I'm like, can we please
could not be more important. So
can we just be real?
I'm telling you, this question is like, I feel like I've been lobbed a softball because this is exactly the kind of stuff I like to answer. So SPF 30, 50, 100, there are only marginal differences between those. So at 30, you get about 97% protection from UVB rays. That's the ones we're trying to keep away from us, right? So 50, you get 98%, and 100, you get 99. So it's not really that much difference between SPF 30 and 100. Really, I would never suggest 100 unless your job is to be a lifeguard, unless your intent is, I am going to the beach and I'm going to fall asleep and I'm going to stay there all day, right? Then you probably should put a 100 on. But remember, if you get in the water, you need to reapply. If you begin to perspire, you need to reapply. Even if you're doing nothing, you need to reapply every 2 hours that you're exposed to the sun, right? So that's what we need to have, one that's hydrating, because we don't want to like a big pancake on our face from putting so much SPF on. And then try to see if you can get it, the daily one, in your moisturizer already, so you don't have to put two things on.
That would make life a lot easier. Yeah. I haven't done it. I'm just like, I got a regular moisturizer and I need to get one with the SPF in it, but I didn't know which SPF level I needed to get. I'm just like,
daily wear though, 15 would be okay if you're just going out and coming back. And if you love your moisturizer, then guess what you can do? You can put some SPF in the palm of your hand and mix the two. That's
actually a really good idea.
You don't have to buy a whole new product. If you have a moisturizer you love, because it takes a while to love something, right?
It does.
If you have one you love, then put it in the palm of your hand and then squirt your SPF and mix it.
That's a really good idea. Okay, keep it with the face, because like I said, I have 1,000,002 questions. I know a lot of women, including me, have been dealing with maskne.
Yeah.
The acne that's coming from the mask.
Yep.
What would be your suggestion as far as like, do we need to be switching out our masks every time I take it off? Do I need to put on a new mask? Or am I okay to wear the same mask all day long? Is there something, a particular way that I need to be washing my face because of this mask? Like, what are all of your suggestions when it comes to, because we still have to wear a mask.
We will be in a mask for some time.
Yeah. So how can we combat acne having to wear this mask?
So there are two things. If you're wearing a cloth mask, which I see people with these beautiful, just ornate masks, that needs to be washed frequently. And my frequently is if you wear makeup every day. So when you buy that beautiful mask, buy 3 at the same time, right? Okay. If it's cloth, because you are putting that against your face, which has makeup on it. And so every day you need to be switching it off. It's cloth. For the throwaway ones, and as a surgeon, I call them throwaway because, you know, we don't ever put the same mask back on. Every time you notice it has makeup on it, it needs to be thrown away. So if you don't wear makeup, like I don't typically wear makeup except around my eyes to go to work. I never take my mask off, right? So I switch out my mask every time I take it off and I look in it and there's debris, that's in a trash can. I'm on to the next one because I do have acne. Now, this is not for the average person who doesn't have any acne, whose skin is resistant to all outbreaks, who just has all the good genes. We're not talking to you. For those people who have all the good genes, no acne, nothing, what I would tell you is don't let your mask get dirty, right? And you can see dirt. When you see dirt on the inside of the mask, throw that away. For us, you and I, Jackie, we have to change that mask every single time we see debris on it because all we're doing is putting that debris back on our skin.
I feel like
I know Amazon's gonna get all our money. They
are, but at this point, I really sit in the shoes of like whatever I need to do at this point to just kind of get rid of the acne. Like I'm willing to do it because I mean, all my life I've dealt with acne, but it is one of those things where I feel like more now than ever, it's really been difficult to get away. And I think it is just a combination of I've been in the house and you would think being in the house would help, but being in the house, I'm not really getting a lot of sun. The mask is on all the time. So
you're still cute though. You're still cute.
Thank you so very much. I definitely appreciate it. Let's talk about some of these products that are out here that people have been getting into, including micro dermabrasion, the kids that are at home, and battery operated exfoliating wands. Are these safe to use?
You know, that's a tough question. I would say if you've had that procedure done before, if you've gone to a spa, dermatologist office, plastic surgery office, and you've had a microdermabrasion before, you know how it feels, then you would know how to gauge using it at home, right? Because they're not going to be the same professional grade. So there is less danger with the ones you would purchase, but you would know how hard to press. You would know what feels like irritation. You would know how long your dermatologist or spa technician took, right? So first have some baseline foundation before you start buying this stuff and using it. Have had the procedure done at least once before, right? Now the handheld exfoliators, I think those are safe because again, this is not professional grade. They're not selling you a $700 product over the counter. You're buying a $20 one off Sephora, Ulta, or Amazon, right? And so there are some safeguards in place because we live in a society where the FDA and all these other companies protect us. So I would say it's okay, but again, you always want to look for redness. You want to look for pain. You want to look for your skin being angry, right? And anger can be a lot of different things. Everybody doesn't turn red. Some people's skin can have a post scaliness. Those are signs that you've either done too much and need to stop immediately or take longer intervals between using the product. Right? If you find it yourself, you're getting red, then maybe not use it every day. Maybe use it once a week or switch it to every other week, that kind of thing, to prevent your skin from being upset. Because what will happen to us is our skin gets angry, then we have that post-inflammatory hyperpigmentation, which is the darkness that comes, right? So that's why you have acne, you squeeze it, then it gets dark because that's post-inflammatory hyperpigmentation. We want to avoid that at all costs. We don't want our skin angry and dark. Any
suggestions on things that we can do to, outside of like, hey, keep your fingers off your face, stop messing with the pimples. Any suggestions on things that we can do to keep that hyperpigmentation down?
I love a product that's over the counter. It's called Bio Oil. They sell it at Target, CVS. I like it because unlike most products that treat post-inflammatory hyperpigmentation, this is not a bleaching product. This is a product with the intent to make all the skin the same color. And that's what I want. I don't want you to make this dark spot light and then it's lighter than my regular skin that I'm trying to conceal it because it's too light. I don't want to be in that circular race. I just want to use something that treats my skin and makes it all the same color. That's what we go for now in medicine and in beauty. We're not trying to bleach skin anymore. We moved away from that.
Is that something that I can use under or on top of a moisturizer? Because again, in my head, I'm like, this acne prone skin gal, here's something that she got to put on her face. Like, it's just going to cause more acne.
It will not contribute to your acne, I promise. You put this on. Now, I tell my patients, it's not going to work in 6 weeks because you didn't get the acne scarring in 6 weeks. That's been a process, right? So it will take some time to work, but I would put it on before I would put on my moisturizer. Or again, I am a palm of the hand girl. I believe in mixing stuff in the palm of my hand like I'm a pharmacist, right? And then I put my hands together, my hands were washed first. Then I put my hands together, I close my eyes, and I give myself a little facial massage with the product. And remember, your neck is considered a part of your face. So we need to go and give our neck some love. Yeah.
And see, this is why we're talking. I don't do that either.
It's a part of your face. You want to make sure you get this upper neck here. This is a part of the face. It deserves to be treated as well, right? So I tell my patients to start by putting your hands over your nose, going up. Every movement is up, right? We're not 16. Every movement is up. There you have it. And then we go over our forehead and catch this neck. It loves us, so we should love it back.
So, and this, again, we have a girl talking, and girl talk, we get real. As far as like, because again, acne prone skin, there's a lot of us dealing with it because of having to wear the mask. Pimples on the face. Should we be popping these, yes or no? No, you should. Now, I will say this. If you have a acne blemish and it's like center of the nose, spot right here,
spot right here. We know we have our mask off, and this is what the part that comes, you hate it so much. I call it a bendy. That's when you wash your hands. I would take the edge of the Q-tip, right? So I'm not using my fingertips. And then I would apply pressure at the same amount on both sides, right? After I get the inside expressed, I will clean that off, let it dry, and then I would use my acne medication on it. Again, I would hope that you just wouldn't touch it at all. But if you have to, we're going to wash our hands, get a cotton ball or Q-tip, and apply equal pressure to the base. Once it's expressed, wash the skin again, right? Let it dry, then apply an acne medication.
Yes, yes, yes. I want to switch gears just a little bit, not a whole bunch, but want to start talking about the body a little bit, because quarantine 15 has been real for a lot of us. And like we said, outside is about to open up. So I'm sure there are a lot of ladies, a lot of women watching right now. They're like, I started this workout program. I've lost maybe a pound or two, but it's not where I want it to be. Summer is right around the corner. I don't know if this is going to work in enough time. What are some other options that women may have as far as getting the body together that will heal and be together just in time for summer?
So are we talking about surgical options, or are we talking about
surgical options? Okay,
because I was going to say, other than pretending like you don't see it, there are no non-surgical options.
Surgical options.
Okay, so our favorite is, and the reason why I'm incredibly busy and I welcome it, is liposuction. And liposuction is perfect if you have a discrete area of fat. We're not talking about you globally look bigger, right? Because I'm not going to suction your entire body. But if you notice that, you know what, I gained weight around my abdomen, I gained weight on my lateral thighs, I gained weight on my arms, and now my arms are bigger because I've been home and not been distracted by life, and I've gained weight, right? Then you can come in and we can treat those areas. If it is excess skin, that's when we have to talk about doing more. Because imagine if you liposuction an area that has excess skin and leave the skin. It's like a sock without a foot in it, and it just droops. And that looks worse because remember, fat gives form. If you remove the fat, it has no form and the skin is just limp and it's ptotic and it hangs. And that's not the look we're going for either.
So what's the process as far as liposuction goes? Is it, is it a 5-week process? Is it an 8-week process? Because again, when you hear surgery, you think like, oh, this is going to be a long thing. So from, I guess, start to finish, how long is that process?
It really depends on what kind you have. So there are other products out that freeze the fat, or there's laser lipo, there's non-invasive lipo. I don't do that. I'm a surgeon. You're going to sleep if you see me. Trust and believe. We're not doing anything away because I don't need your help, right? So if you see me and we do liposuction, I tell people, if I just do one area, you should expect to be down for a couple days, like sore, right? You just don't feel your best. Your maximum results, you'll see them at 6 weeks, but you'll begin to see results immediately, right? So I would say if you have liposuction, try to stay, put, don't make any major plans for about a week and a half or so. After that, you should start to feel better, look better, but your maximum results are at 6 weeks. That doesn't mean you won't have results. It just means your maximum results are at 6 weeks. I have my patients get lymphatic massage as well. So they're massaging all the fluid out. They're making sure it's smooth and looks good. And so by 6 weeks, you are shining. I mean, your star is bright, right? Then you'll be ready.
Are there any follow-up appointments after the 6 weeks?
I see my patients until we're both pleased. So I don't have a number that I say. Now, some patients I see and I never see again because they're so happy. They're just naked running down the street, right? But then other patients I see until we're ready to move on past that. And typically, I see people until 6 weeks and they're ready at 6 weeks to move on. But if they're not and they have an area they're concerned about, then we discuss it until, again, we're both ready to move on.
And you can get liposuction in the stomach, the arms, the legs area. Is there a part of the body where liposuction is just like, no, ma'am, you can't do it?
Right. I typically don't liposuction below the knee.
Okay.
Yeah. So I typically don't liposuction. I'm not saying you couldn't have it. I'm just saying my practice is not to liposuction below the knee. I liposuction the chin. I liposuction in the face all the time. But I wouldn't do that because that blood supply is so tenuous. I'm just not willing to risk losing a limb over trying to have a small calf. So
and that makes a lot of sense. Just do some calf raises and we'll call it a day.
Jackie, that's your client all the way.
Come on. So also, I know you mentioned like tummy tuck. Can you like tuck the skin on certain areas of the body as well?
Absolutely. That's a great question. So I am in the same suite as a weight loss surgeon. And so a lot of the patients after they lose weight have incredible amounts of excess skin. And so we can remove the skin from the arm. That's called a brachioplasty. Remove the excess skin from the breast. We do breast lift. We do reductions. We make them larger, augment them. In the abdomen, a tummy tuck, we do thigh lifts. So you can have a medial, which is inner thigh lift. You can have outer thighs lifted as well. And then, of course, people have the rolls on the back. That's been most concerning to people. And so we do those excisions as well.
Okay. You just mentioned breast augmentations and reductions. When would you suggest somebody getting an augmentation, and when would you suggest somebody getting a reduction?
Great question. So typically people have an augmentation if they just want to be larger, right? They decide, you know what? I may not want to change where my breasts are on my chest wall. I just want them to be bigger. If you want to change where your breasts are on your chest wall, that's called a lift, right? So if you like how the size, but they've gotten tonic and you want to lift them up, that's a breast lift. Reduction typically, not all the time, typically happens in women and men who have symptoms. So I mean, they have back pain, neck pain, they have perspiration and rashes under the breast, right? Those are indications to then have a breast reduction, because we're going to reduce the breast by at least 2 cup sizes. So if you don't have 2 extra cup sizes, then we're really not talking about a breast reduction. But men get breast reduction surgery as well because they can develop breasts. And you can imagine how socially, emotionally deceiving that can be for a man to have breast.
Yeah. What's the recovery time on those? I know we talked about with liposuction. So what is the recovery process, or just the process from start to finish with an augmentation or reduction?
So the augmentation is a little bit easier. That is typically a long weekend. I have patients start to move and get back into their activities of daily living. No trauma, no contact sports, anything like that for a couple of weeks. You're not in the gym doing pec and latissimus exercises. We're not doing any of that because we don't want that implant just moving around too much, right? For breast reduction, that recovery is a little bit longer because there are more incisions, right? And so we want to make sure that, again, no contact sports, no strenuous activities, no in the gym with doing upper body work for at least 6 weeks. And that's just my personal preference. Some people go back earlier, but I really want my patients to hold tight for 6 weeks, and then you can just go and do everything. But until those 6 weeks, we put the safeguards up.
Okay. You're giving a lot of information right now, and I know a lot of people are like, hey, maybe I need to seek a plastic surgeon or a dermatologist. What would be your advice as far as like seeking, or what do I need to look for when I'm looking for a dermatologist or a plastic surgeon? Because there's a lot out here, and everybody doesn't get it right.
Nope, they don't get it right. You know what I found, and a lot of people ask me all the time, Dr. Fripp, why don't you put before and after photos on your website? Why don't you advertise? Because my best advertisement is word of mouth, right? So I did your sister and I did your best friend, you didn't even know it. But when you asked them, they told you, right? It was me. So word of mouth is always the strongest referral. Also, I would ask your primary care doctor, who do you refer your patients to? Once you get in the office, there are some questions you need to ask. Do you do skin like mine? Are you board certified? That's huge. Are you a plastic surgeon? Not a cosmetic surgeon. Are you a plastic surgeon? Did you train in a plastic surgery residency or fellowship?
Okay? So what's the difference between the two? Because I'm like, hold on, wait a minute.
Huge question. So a cosmetic surgeon is anybody who can call themselves a doctor, right? It could be your ophthalmologist. It could be your OBGYN, your family practice doctor. It could be anybody that can call themselves a doctor. A plastic surgeon, baby, is a gold standard. So a plastic surgeon is a person who has gone to a plastic surgery residency or fellowship and is trained in not only how to do it, but how to treat complications, how to manage expectations, and how to do things in a way that's duplicated that can be duplicated so that you have the best results, right? You don't want somebody who did it once and had a good outcome and then did you, and now you're in looking like you need to have something else done. Let's just say that.
Who did it and why?
Who did it, why, and don't ever do it again.
So what about dermatologists? Any suggestions?
Yeah, you know what? I think that dermatology is really a field that does not get the attention because they actually are trained for 5 years as well. I mean, they're dermatological surgeons as well, if they do other training. So dermatologists, to me, are the gatekeepers for all things skin, all things beauty, because they know that is what they're looking at, the skin. That is the organ that they treat. Now, it's the largest organ in the body, but dermatologists, they are the ones who know it. They have their finger on the pulse. I have 2 dermatologists, actually 3, who I live and die and breathe by in the District of Columbia and Maryland, because I only send my patients there. So a dermatologist, you want to ask them and make sure, are you a trained dermatologist? Did you do a residency in dermatology? And it's sort of hard to fake that. But this cosmetic surgery thing, girl, has worn us out.
Listen, I can only imagine. DMV, Dr. Fripp is hanging out with me. We're having some girl talk right now, and we needed to have this because talk about the questions that I know I have and you guys have about everything that's been going on with our bodies these last few months and last year, to be honest, because of COVID-19. So Dr. Fripp, thank you so much for just, again, taking a few seconds to talk to me about things that we could be doing right now, going into the summer to make sure that we are living and looking our best. For people that want to reach out to you to get more information and to even possibly book a consultation or schedule an appointment, where can they contact you at?
I would love to see them. My office is at the University of Maryland, Capital Region Health in the National Harbor. Our number is 301-809-2013. I also have an Instagram page, which is Dr. V Fripp, and they can follow me on that page as well. But I would love to see them in the office. And remember, if I can't do it, I won't hurt you. If I can't help you, I would never hurt you. So I have a huge referral of doctors who we'd be happy to send you to. And there are other amazing plastic surgeons in the District of Columbia, Maryland, Virginia, who we would refer you to if we can't do it.
And one lasting word that you would give to women watching this right now who are just kind of on the struggle bus and just weary about their skin and their face right now, what lasting word would you give them just to kind of uplift their spirits a little bit about what they've been going through?
I would tell them to inhale and then exhale and just know it's not the end of the world. It's not. It's not. We have made it through this pandemic. So already we're survivors, right? So we're going to inhale together, exhale, and it's not the end of the world. We're still here.
We are. And if you need somebody to go talk to and see about what you got going on in your life, Dr. Fripp is right here. So hit her up right now and get it together. Summer is right around the corner. Dr. Fripp, again, thank you so much. DMV, thank you for tuning in to Girl Talk Live. It's been so much fun. Have a great day.
Bye.